This topic will be discussing the patient positioning and of course the log rolling technique for patient with spinal injury. So last time we have talked about the bed sore precaution and of course the fall precaution in connection of course with the spinal cord injury. So when we say patient positioning, it involves properly maintaining a patient's neutral body alignment by preventing hyperextension and extreme lateral rotation to prevent complications of immobility and of course injury. So what it's our goals of positioning? Of course, we need to provide patient comfort and of course safety. So it's very hard for the patient that she will just stay in the bed for almost actually even for a short period of time. It's very uncomfortable to just stay in one position. So it is much better if you will just do some turning with your patient. And of course, you need to do this position in a safety manner so that you will not be adding injury to the patient. And another goal, of course, is to maintain patient dignity and, of course, patient privacy. So, in doing any kind of procedure to the patient, actually, in some procedure, even though hindi natin gusto na ma-expose yung a certain part of the patient, sometimes while doing the procedure, meron talagang ma-expose. So what are we going to do as nurses? So in doing any kind of procedure to the patient, make sure that you cover the patient or might as well use the curtain or the divider to cover your patient or might as well use an extra linen to cover your patient and allows maximum visibility and of course access. So the reason why we do some certain position is of course for the attending physician or for the examiner to easily access, to have an easy access to the parts that needs to be examined or to be tested. Now, the next thing would be, what are the principles and guidelines in doing some kind of positioning? Of course, as nurses, we need to explain the procedure before doing that kind of procedure. Then, of course, you need to encourage client to assist as much as possible kung kaya ng pasyente. If in case that the patient is having this kind of injury, like for example, the spinal cord injury, much better if he himself will not help us anymore because it will only add to the pain and of course it might also add injury to himself. So might as well tell him to relax and we will just do our part. Then get adequate help. So in doing some kind of positioning or even the turning and even the lifting, we need to ask for help. And whom are we going to ask for help? Of course, we need to ask for help from the nursing assistant and even the hospital orderlies. What else? Use of mechanical aids. So, ano ba yung mga mechanical aids that we're using in lifting the patient? We are using, of course, the turning sheet or the lifter. Or we can also use of the spine board kung meron man doon sa hospital unit ninyo. And even actually, in some, they're using the cardiac board for lifting the patient. But that one is very thick kasi, so it is not advisable. So we're using just the cardiac board if we're doing the CPR. Then, of course, we need to raise the client's bed. Okay? Siyempre, if you're about to raise the client's bed, make sure na hindi ka na mag-stretch pa ng likuran mo para lang maabot yung yung pasyente mo because it's according to your height or according to your movement na kung paano mo in-raise yung bed ng pasyente ninyo. Then frequent position changes. So the reason why we're doing this positioning is of course we need to prevent the accumulation or even the what you call this, the bed sores, what did you call it, the bed sores. We are preventing that one to happen. The reason why we're doing the position changing. Okay, what else? We need to also do this one because we need to prevent also the pneumonia, acquired acquiring pneumonia to patient. Then another thing is for them also to feel relaxed and feel comfortable. Kasi nga mahirap naman talaga na ang pasyente will just be staying in one position only. Then avoid friction and shearing. So if you will be lifting, if you will be turning your patient, avoid this one. Because this one can also lead to start of heavy bed sore actually. Kasi magkakaroon na siya ng, once you there's a friction, syempre mamumula yung skin ng pasyente ninyo, and that's the time magkakaroon ng blister, and yun na, mag-start na siya. After the blister, pumutok na yung blister, and that's the time magkakaroon na siya ng patuloy-tuloy na bed sore. Especially if the nurse who will be in charge for that patient, hindi naman talaga ganun ka-caring with regards to his patient. Then, also, you need to also to observe proper body mechanics. So when we say proper body mechanics, you need to position yourself close to the client. Okay? Then avoid twisting your back, neck, and pelvis by keeping them aligned. So if you will be sabihin na natin if you're maintaining your posture while you're in your college days, lagi kang naka-straight body. So, might as well, if you'll be handling patients in the hospital, might as well maintain that posture as well. Okay? Then, flex your knees and keep feet wide apart in doing the lifting or even the turning. Then, use your arms, legs, and not your back. Okay? Then, tighten abdominal muscles and gluteal muscles in preparation for the move. So, as you can see, sabi dito, use your, sabi dito is flex your knees and keep feet wide apart. This is the reason kung bakit kailangan natin gawin ito. Because we need to practice the equal division of the weight bearing, kumbaga. Okay? Kasi kapag feet wide apart yung position mo and your knees is a little bit flex, makakagalaw ka. Lahat ng, sabihin na natin ng gravity, mapupush downward into equal parts. Kasi nga, ganun yung position mo. Okay? So, tighten abdominal muscles and gluteal muscles in preparation for the move. Then, person with the heaviest load coordinates efforts of the nurse and initiates the count from 1 to 3. Okay, so let me just clarify this one, the last sentence. So it is much better that the one who will lead or who will be the coordinator will be the nurse in charge. Kasi it is much better for the nurse in charge to coordinate or to lead the procedure because she was the one knowledgeable for the procedure. Okay, so she will be the one to dictate or to give instructions to the colleagues. From the count of 1 to 3, we will be turning the patient. Okay, sir, ma'am, so can we do that one in that counting of 1 to 3? Okay, so yun. So you will be acting as a leader in that kind of scenario. So what are the common patient positions? So we will just be tackling the common patient positions here. Of course, we have the supine position. It refers to a horizontal position with the face and upper body facing up. And in the supine position, the ventral side is up and the dorsal side is down. So when we say the ventral side is one, the front one is the ventral side and the dorsal side is the back of the patient. Okay. Then a number of surgical procedures is being performed in this kind of supine position. And what are those? Of course, if you will be exposing the thoracic area or the thoracic cavity, and if the examiner or the physician will be doing some human dissection and even some autopsies, this supine position is very much applicable. Then what else? So this is the picture or the visual presentation of the supine position. So just a flat, okay? Then prone position, it refers to a horizontal position with the face and upper body facing down. So in the prone position, the dorsal side is up and the ventral side is down. So kung kanina nakatihaya yung pasyente, so this time around the patient is nakatayo. Okay? So a number of what are the surgical procedures who uses this kind of position? Of course, if the patient will be requiring access to the spine. And another thing is this kind of position, it also helps to increase the oxygenation in the patients suffering from the respiratory distress. So So here is the visual presentation of the prone. So as you can see, kahit nakataob siya, so syempre yung head part niya dapat nakaside pa rin para at least kahit pa paano nakakita yung pasyente. And what else? As you can see, you need to place pillow on the abdomen and of course on the leg part of your patient. Now what about the Fowler's position? This is also known as a semi-sitting position. So this one is a bed position where the head of the bed is elevated from 45 to 60 degrees. So we have different variations of Fowler's position. We have the low Fowler's, which is 15 to 30 degrees. And we have the semi-Fowler's, which is 30 to 45 degrees. And high Fowler's, which is nearly vertical. So, yun yung mga different variations of Fowler position. So, why do we need to position the patient in this kind of position? Of course, this will help the patient to promote lung expansion. And of course, what else? It is also used for patients who have difficulty of breathing. So, makikita niya, if you will be visiting the hospital, you will be hearing from the doctors, oh ma'am, hirapan yung pasyente mong huminga, ilagay mo na yan sa Fowler's position. And even though the doctor will not tell you to do will not give you such kind of direction, as a nurse, you should know that kind of position. Okay? So, why are we doing this kind of Fowler's position? Because this one pulls the gravity down the diaphragm, allowing the greater chest and of course lung expansion. So, this is what we call the Fowler's position. Okay? Then, what else? We have also the orthopnic or the tripod position, wherein we place the patient in a sitting position or on the side of the bed with an overbed table in front of him to lean on and several pillows on table to rest on. And this same thing with the Fowler position. This will help in the maximum lung expansion of the patient, and this will help also in the exhaling. So this one is what we call the orthopnic position. So we're doing this kind of position even if we will be doing a certain procedure like CTT insertion or the chest ultrasound guided procedure. So we're doing this kind of procedure. So ito yung sinasabi nating overbed table. Okay? So dyan naka-rest. The patient will be resting there, of course, with a pillow. Then, what else? Another type of position, of course, is the Sims position, wherein the semi-prone position is when the patient assumes a posture halfway between the lateral and the prone position. The lower arm is positioned behind the client, and the upper arm is flexed at the shoulder and the elbow, and the upper leg is more acutely flexed at both the hip and the knees than in the lower one. So how are we going to visualize this one? So this one is what we call the Sims position. As you can see, this is somewhat kind of the prone position. The only difference is yung pagkaka-deviation ng mga legs niya. So as you can see, there is a pillow supporting the knees part and the leg part of the patient. Even the elbow and the arm of the patient is also supported by the pillow. Okay? So, this one is what we call the Sims position. Now, what about the Trendelenburg's position? This involves lowering the head of the bed and raising the foot part of the bed. And the patient's arm should be tucked at their sides. So, this position is used to promote venous return and, of course, for the postural drainage. So, this position is very much applicable if the patient is suffering from hypotensive. Okay? So, this one is what we call the Trendelenburg position. So, in some other hospital, there are times na it means that the bed is not functioning well. So, if you will be asked to do a modified Trendelenburg because of, sabi nga, your bed is not functioning well, so you will just place stacks of pillow at the bottom part of the patient, at the foot part of the patient, so that you can make a modified Trendelenburg position. What else? Now, moving on with the spinal cord injury patient. Okay, dun sa mga patient na talagang merong spinal cord injury. So, what would be the position of the patient? So, of course, there should be an immobilization on the spinal backboard. The head should be in neutral position and should be immobilized with a firm padded cervical collar. Then it must be lag rolled without allowing any twisting or bending movement. So what would be the rationale? Why don't we allow this twisting or bending? For us to prevent any movement and of course further injury to the patients. Now there are different types of lag rolling technique. So we have the 4 persons technique, wherein we uses the person 1, which will act as is the one handling for the head and neck, the immobilization of the head and neck of the patient. And the person 2 should be handling the shoulders and the pelvis. And the person 3 will be handling the pelvis and the legs. And the person 4 is the one directing and moving the spine board. So in some other hospital, they can easily perform this kind of technique if they have this ample amount of manpower. But if you don't have any manpower, you might as well be using the 3 persons or the 2 persons for as long as you maintain the neutral alignment of the spine of the patient. So this one is the 3 persons technique, wherein the nurse in charge will be the one handling the head part and the neck part of the patient. Okay, so as you can see, this one should be supported. Okay, so you will be handling your patient like this. So dapat nakasupport yung dalawa ng kamay niya. Okay, so that one is the nurse in charge. Now what about the other persons? Of course, the other persons will be handling the shoulder. Okay, so holding the shoulder and this part, the thigh part. Okay, then the other one will be holding the hips. Okay, hip, and of course the leg part. Okay, so up from the count of 1 to 3, of course the team leader will be the one to instruct that counting 1 to 3. Okay ma'am, sir, nakaposition na po ba? So dapat titingnan niya rin kung paano yung mga position ng mga kamay ng pasyente niya, anong mga kasama niya. Okay, then from the count of 1 to 3 po 1, 2, 3, go, turn. Okay, so i-instruct din dapat ng nurse in charge saan ba dapat mag-turn. Is it from the left or on the right? So in that way, kahit paano magkakaintindihan talaga yung mga nurse in charge and of course the 2 colleagues that who will be helping you in turning the patient. Okay, now what about the 2 persons? So as you can see from the picture, the 2 persons, they can do this technique if they have this kind of turning sheet or the lifter. Okay, because knowing this 2 persons, it's very hard to turn the patient if there would be no mechanical aid that will help you in doing the turning. Okay, so in lag rolling technique, of course, as nurses, you need to do hand washing before any procedure, then to provide privacy, so you need to close the curtain. Patient identification, of course, the use of the ask for the patient's name and of course the birthday, and check of course the ID band. Then do your self-introduction and explain procedure to your patient. Then you need to perform the baseline assessment of his neurologic status, including his mental status, movement, and of course the sensation. So anong po pwede nilang itanong doon? So ang instruction nyo kasi dapat ang kamay ng pasyente, both hands of the patient should be crossed over his chest. Okay, so the arms. And what else? To assess for the mental status, the movement of the sensation, you might as well ask the patient, ma'am, can you move your fingers and of course your toes? Okay, so dapat nagagalaw na to. Okay, then use lifter or turning sheet, making sure it extends from the above the shoulder. So dapat ang turning sheet nyo lalagpas dapat dito sa shoulder at up to the lalagpas din siya dapat dito sa may below his hips. Okay, para kapag tinurn yung pasyente, talagang well supported yung spinal alignment ng pasyente ninyo. Then cross his arms over his chest. raise bed to an optimal working level with both staff on the same side of the bed. Then as you can see, if you will be lifting the patient with the use of the turning sheet, of course you will be going to the bedside. So you need to lower the side rails, then roll the turning sheet against the patient. So kukunin nyo muna yung pinaka-excess ng turning sheet. So assuming this one is the turning sheet of the patient. Okay? So sabi kanina, dapat below, above the shoulder level, and of course below the hips. So dapat ganyan ang lift turning niya. Okay? So kung halimbawa yung mga turner ninyo, mga colleagues ninyo nandito sa left side, so una nyo gagawin, baba nyo muna yung side rails, then you will roll this sheet, then hatak ng konti. Okay? And afterwards, what would be the next procedure? After rolling the turning sheet, raise the side rail up and move to the other side. So pupunta naman dito. Your helper will be going to this side again. Then position yourself and your colleague facing the patient. Then of course you need to lower your side rail and place pillow between his legs. Then you will now be reaching. Okay, the helper will be reaching now the turning sheet that you rolled before. Okay, so they will be handling this one, and even you, if you're responsible for his upper body, considering that you're the team leader, so you will be holding the neck part and the head part of the patient while reaching for the turning sheet. Okay, so you will hold this turning sheet, and of course the other colleague will also be holding the turning sheet as well as the hip part and of course the leg part. Okay, then at the count of 1 to 3, while holding the turning sheet, you will the team lead will count for 1, 2, 3, then turn to your side. Okay, then after turning to your side, dapat sabay na sabay talaga. Okay, simultaneously. So you will maintain the spinal alignment. Okay, then you will put pillows between the legs of the patient. Then after that, to synchronize your movements with your colleagues, count from 1 to 3, which we did before. Then gently turn the patient so he rolls like a log egg. The shoulders, spine, hips, and knees turn simultaneously. Support his backs and legs, back, buttocks, and legs with pillows to maintain a side-lying position. So if you've already placed the patient in a side-lying position like this, so you will tuck in. Okay, you will tuck in the pillow here, so that if in case that you will be leaving your patient on this kind of position, there will be a pillow supporting with the patient. Then after that, maintain a side-lying position, then raise the side rails up. So kung dito nakaharap yung pasyente ninyo, if the patient is facing you, so you need to put the side rails up here, and also place also the side rails up on the other side. Then reassess the neurologic status and comfort level, and do your documentation of the procedure, and of course the patient's response. So, and what are the don'ts that we need to be reminded of? Of course, don't try to lag roll patient without any help. Okay, you could both hurt yourself and even the patient. Then don't move patient until both people are prepared to move in unison. Okay, simultaneously. Then don't twist the patient's head, spine, and shoulders, knees or hips while doing the lag rolling technique. Okay, so that's it for today, and I'll be posting also the sample video presentation for you to have an idea of the actual lag rolling technique for patients suffering from spinal injury. So thank you very much, and hope to see you by next week. Thank you.